2, after further investigation, an additional subject, a 46-year-old male, was charged with disorderly conduct and disturbing the peace. Another subject in Monmouth Beach was arrested for being at a closed pavilion in violation of the executive order in order to smoke a controlled dangerous substance. And in Camden, a large gathering of 20 or more people who were arguing was broken up, and a woman who refused to comply with the officers' orders to disperse was also charged. That's all I have, Governor.
Colonel, thank you. And again, I meant to give this shout out earlier to Governor Newsom. All I can say is I hope that we have a Lafayette we are here moment, and we can say that it may take some time, but we will return the favor as soon as we can responsibly do so. So thank you for all that. And again, we're going to enforce. We reserve the right, as we've said today. Again, with mixed emotions, but there's no question we have to do it. Closing state and county parks, so we reserve the right to take further action, but in most respects it's going to be whether or not all 9 million of us are adhering to the actions that we've already taken. And thanks to Colonel Callahan, the Attorney General, and to law enforcement up and down the ladder and up and down the state, enforcement is going to be the name of the game. So thank you for that. And for every day. I think with that, Matt, I don't want you to pull a hamstring, so I'm going to give you a second to get over there. We'll start with Brent, and we'll sweep from my left to right. Just while you're doing that, tomorrow, I think at 10:15, we're touring the field medical station in Edison, and I'll be there for a brief with the Colonel, and as we mentioned, I hope Senator Booker and some representatives from our military and Army Corps. And then we'll be here tomorrow, unless you hear otherwise, at 1 p.m. Thursday is always subject to whether or not there's a White House VTC, and assuming we can get the data, and so bear with us on this, in respect of folks who observe Good Friday, and I would be on that list, we are likely going to be here, but earlier than normal on Friday, try to finish before noon if we can. So we'll give you more details. Mahan will let you know. Brent, we'll start with you.
All right, so I have a few because I'm reporting for other people. One, the public health emergency, that's the state of emergency you ordered on March 9th that's been extended. Two, I missed the racial breakdowns, and was that for total cases or just the new ones?
Keep going.
Three, how many total cases, active and inactive, would we be expecting at the peak, whenever we're expecting the peak? Are you aware of a standard policy of issuing 1 surgical mask and face shield per employee per week? Is this acceptable? Are we really that bad off? How does this policy not spread infection? Should candidates not be campaigning in person or door to door? How many police officers have tested positive and how many are quarantined? New Jersey has the 5th highest number of legal immigrants with healthcare backgrounds who are not working in the healthcare industry because they hold degrees from foreign universities. Are these among people you're asking to volunteer to help cope with the virus? You mentioned coordinating to restart the economy. This is from Politico. You mentioned how you're coordinating a regional approach to restarting the economy. Do you anticipate this will rely on widespread testing in each state? And how long do you think?
I just want to ask, do you think we should, maybe we'll just roll into tomorrow's briefing? How many more do you have, man? Come on.
How long do you think it will take to scale up testing to that level? I could go all day. So.
Yeah, we love you, but we can't let you go all day.
Right, go ahead.
Do you have a microphone, Paramel? The public health emergency from a month ago, just if you real quick answer Brett's first question.
Sure. So
Brett's question started yesterday, so I think that was his first question.
Today's order is just extending the public health emergency. The state of emergency that we declared on March 9th is indefinite, so that didn't need to be extended. But the public health emergency pursuant to the law the legislature passed has to be renewed every 30 days, or else it expires.
What order number that was?
It was Executive Order number 103.
103. Thank you for that. Judy, one more time on racial breakdown. Do you have that handy? Do you have your mic there?
Yeah, this is, these are obviously, excuse me, not all of the cases. Of the 729, excuse me, known cases.
Again, this is 729.
Yeah.
cumulative, you'll note that there's another almost 500, or perhaps more than 500 that we still
670.
don't know yet, right?
60% or 435 are white, 24% or 175 black or African American, 5% or 36 Asian, and 11% or 83 listed as other.
I would just say this, that is I meant to say this earlier when I made the comments about, as imperfect as it is, getting the racial breakdown is something that we all feel is important. Just without knowing what's in the other category, the number that jumps out is the African American number as it relates to the overall population. That is a meaningfully higher percentage, at least of that cohort, than it is in the state of New Jersey. Judy, total cases, as I remember these, total cases at peak?
According to the Lashmi model, I believe it was 37,000.
I thought 36. I'm in the same neighborhood.
Yeah.
Again, this is, remember, the Lakshmi model we showed you yesterday had as the runaway freight train number of folks who are infected as just about 3 million. Good news and bad news. Good news is, based on the evidence that we have, and this is a, you know, we're in the second or third inning maybe at most, but based on what we now know, we've brought that number down, the range for that number down meaningfully in terms of total persons infected. The Lakshmi model, and again, I'm not referring to Chime, but the Lakshmi model's worst case is 509,000, as I recall.
Yeah. It's over 500.
Over 500,000 infected, and from that, 35,000 folks would require, 35 or 6,000 require hospitalization. Again, may I just say this? Those are still huge numbers, and the 36,000 hospitalizations, no matter all the heroic efforts that are being put in to expand capacity, that is outside of any realistic ability of us to withstand that. So the social distancing must continue. We have no choice. One surgical mask per person per week. I've not heard that. Is that what type of workers are we talking about?
It's a question from one of my colleagues sent me, so I'm not sure.
I'm not aware of that. Are you?
Yeah, I'm not aware of that either. We are looking at what hospitals are currently doing in New Jersey, because some hospitals are determining their own guidance, and we're looking at what's going on nationally, making sure that we have the appropriate masks for the clinical staff. We are looking at putting out guidance for masking after we finish finding out what the rest of the nation's doing.
I'm not sure who you may have in mind, Brett. I'm not running for anything right now, but my personal opinion is people should not be going door to door campaigning, period. That's not what we need right now. Stay at home, pick up the telephone, send an email, send a text, unless I get any disagreement from the right. Police officers, number of infected, did you have? I'm sorry?
A number of police officers who have tested positive, and how many are quarantined?
I got that, Go.
Okay, Pat.
As of today, as of this morning, it was 562 statewide tested positive, and right now 2,941 are self-quarantining.
Thank you.
Pat, do you have any, I should know this, what's the denominator total law enforcement?
I think it's 36,000.
I was going to say 35, so
Yeah.
the same. This seems to be a convenient number, by the way, 35, 36,000. Just looking at and I'm looking at, how many quarantine again, pardon me?
Almost 3,000.
Almost 3,000.
So we had, to give you an idea, within the next 48 hours, 111 will be back to work. So we're on a daily call with
Cycling through.
just always making sure that we're able to provide law enforcement.
This is another reason. I mean, we've talked about the heroic healthcare workers, the first responders who have to go in and enforce what we're talking about. They're putting themselves in harm's way, and they're doing this at less than capacity. Brett, your illegal immigrants question, you said we're top
It says,
five?
this is again from colleagues.
Yep.
I get like 30 colleagues send me questions a day.
No problem.
New Jersey has the 5th highest number of legal immigrants in healthcare who are not working in the healthcare industry because they hold degrees from foreign universities or do not speak English well. Are these among the people you are asking to volunteer to help cope with the coronavirus?
The answer is yes. We were pretty definitive about the fact of, my friend Felix Roque in West New York was pounding away on this point for many days, and the answer is yes, but they've got to go through a process, right? So they've got to sign up in the regular way to sign up and volunteer. It's the volunteer page on the covid19.nj.gov. And then you were saying, your last one was...
This is from Politico about the regional approach to restarting the economy. Will that rely on widespread testing in each state, and how long do you think it will take to scale up to that testing level?
I would say too early to tell, and perhaps other governors would have more color on that, but I mean, the House is still on fire, and we're still fighting the fire, but we acknowledge, and that was the basis I was on last night with the Center for American Progress. I mentioned Andy Slavitt earlier. That was the basis of a lot of the part of my conversation with Governor Cuomo. It certainly, and Judy and Ed, tell me if you see this similarly, the notion of contact tracing is going to have to be a big part of making sure that the house doesn't catch on fire again. There's going to need to be infrastructure. You know, what's a restaurant look like? You know, do you have somebody with a temperature gun at the outside? And what are the protocols going to be for servers and capacity and distance? I think too early to tell, but we can't, I do know this, we can't wait X weeks or a couple of months to begin to be, we have to start that, which now, and we think that if we do it on a regional basis, just as we did when we closed the economy and we closed our states, we'll be a lot better off for that. Ed, anything you want to?
Yes. What the governor said, basically, you know, right now when we're hopefully moving towards the top of the curve and we have 44,000 cases and that sort of thing, contact tracing and all those people is just not possible. As we begin to slide down the curve, as our number of cases decrease, then yes, certainly beginning to go back to that basic epidemiological response where you try to find those people, you try to isolate them as soon as possible, it becomes extremely important.
Thank you for that. I think we're going to Dave next. Dave, good afternoon.
Hi. So, Governor, as you are, I'm sure, are aware, high school graduation is a big deal, not only for the kids, but their families, relatives, and so forth. And it seems extremely obvious at this point, even in the best case scenario, we're not going to have large gatherings for high school graduations at the end of May or June. Question for you and the Commissioner. If there has not been any specific plan made in terms of delaying those ceremonies, possibly, as the Commissioner had indicated to me before the press conference started, what would your advice be to families in terms of how to look at this issue? Would it be possible that we may have bigger kinds of celebrations later in the year that the individual schools might suggest? Is there going to be a virtual graduation when kids graduate at the end of the school year, which presumably is not going to start again, and so forth? Another question for the Commissioner. You had mentioned that 110,000 kids, I believe, in New Jersey did not have any access to the internet. So that's like 10% of the state's children. How are they learning? What are they doing? In simple terms, are they getting any lessons? Or is there, I mean, what, if anything, is being done with regards to trying to help those kids at least have some kind of structure and assistance and learning and so forth? And the final question for the woman who needs no introduction. You had mentioned the plan by the state to try to help the long-term care facilities and separate those patients who may be asymptomatic or we don't believe are sick now. But as we know, this can be tricky because they may appear to be asymptomatic. Obviously, this is a plan in flux and you're just starting to put this together, but can you talk a little bit about how this is going to be handled? Would they, if they're moved, would they be in a quarantine situation? Is everybody going to have to wear masks? You know, where are they going to go? Is it going to be in the same region of the state, or et cetera, et cetera?
I'll start with the first one, Dave, on the graduations, and then maybe turn to Lamont for anything on that he wants to add, as well as how are the kids learning. You know, we had talked earlier about pre-printing materials 1 month at a time. I'm sure that's part of it. And then, Judy, to you on the long-term care. I'm not trying to be flippant, but I wouldn't put any non-refundable checks down on your on your celebrations right now. I mean, it's hard to say otherwise. I hope I'm wrong, but I fear that I am not. Again, we're going to get through this. There's no question about it. And notwithstanding what Judy and I have said about the fatality, bless each of those souls, the numbers moving around, the testing numbers are beginning to look like there's a trend, and I hope I'm right about that. So, you know, slowly but surely, assuming we keep our foot on the gas, we are going to get there. But I think you would be, you wouldn't be, you know, in my shoes, you wouldn't be dealing with the facts if I were to say publicly right now that you should feel okay about a late May, early June graduation celebration. I just personally don't see it. I hope I'm wrong. Whether or not we can come back and figure out something creative, I hope we can. And my suspicion is that'll be up to the district or to the private school or the religious school to do something creative on their own, just like we're seeing, sadly, funerals and memorials, weddings, births, bar mitzvahs, confirmations in a very unique, creative way. My guess is you'll see something similar applied to graduations. Any thoughts on graduations and also importantly on remote learning?
Yeah, you're actually correct. The governor's correct. Yes, I am, sir. Graduation is a local decision, so whatever event and activity they plan, we just hope that they follow the health guidelines as far as social distancing and things of that nature. And we'll provide whatever support necessary for those districts that chose to go graduation. But when it comes to that time, and in regards to the tool online learning is just one tool. The goal for us, the objective was to provide continuous instruction. Continuous instruction can look like many ways. In some districts, we have, as the governor said, pen and paper packets go home every month. Kids get them back. They have their books. They have book reports. So it's various tools that you can actually use. Online is just one tool, and it's popular right now because a lot of technology. However, there are districts that go back to just the pen and paper traditional route.
Could I just ask a follow-up, Commissioner? Are you getting reaction, feedback from your different school districts? Is that working? Are kids doing what they're supposed to be doing? Are they getting encouragement? Is the learning taking place the way you envision that it would and should?
Governor? Okay. No, I'm very pleased with where we are. I mean, in 20 days, we asked them to go from a brick and mortar school to a virtual learning school. So you know there's going to be challenges. I talked about earlier about the digital divide. And you see right now we're addressing those issues. Districts are taking upon themselves to address those issues as well. So we're very pleased with that. Some of the challenge you're going to have is youngest of learners that I indicated earlier. How do you parents at home working with these younger students that normally have one-on-one or paraprofessionals. So we're seeing some of those challenges, but we're also looking some innovative approaches that our districts are doing, whether it's looking at YouTube, whether it's the partnership that the state has with the Department of Education, NJTV, and also NJA to provide educational programming. So it's an individual localized situation, but our job is to support them every which way we can, whether it's support for professional development, professional learning, which is one way, whether it's just providing guidance across the board. So right now we're in a position we're very pleased with where we're going right now.
I would just add a couple of quick things, and Judy, you should address the asymptomatic question as it relates to long-term care facilities. You can't bat 1,000, as we've never done this before. We've got per capita more school districts than any state in America. We've got more school districts than we have townships. So you've also got a question of execution at the local level with strong state leadership and state guidance. And then you've got the other realities, and Christine Norbert-Beyer referred to this when she was with us last week. We have to also remember that things like, we saw that very sobering chart of lesser child abuse reporting. I'd love to think it's because less of that's going on, and please God that is, but it's much more likely that there is less interaction with teachers, coaches, nurses who would otherwise have seen that. So that's another part I know of not just Lamont's focus, but also of the other state agencies and departments. Judy.
Sure. The direction that I've given to the team is to look at a statewide plan, but with a regional approach. And there will be an algorithm where we'll identify patients, for example, asymptomatic, no exposure, asymptomatic exposure in an organization where either the employees or the other residents that there's a significant cluster or outbreak, symptomatic but test negative, symptomatic, and test positive. And I'm sure there might be more iterations of that. And then we'll identify the most appropriate location for the resident to be in. And within the locations, there will be all infection control precautions taken, along with cohorting of the residents and also cohorting of the staff. We have found that staff going from facility to facility and then within facilities have lend itself to some of the problems that we're seeing. So the algorithm is going to be a little deep, but we think we can do it, and actually we must do it.
Thank you, Dave. Thank you, Judy. Do you have something, sir?
Governor, a couple questions for the reporters at NJTV News. So as long as we've been getting together like this, we've been talking about people who aren't listening or adhering to your social distancing guidelines. Is there a tipping point where you implement a full lockdown? Is that on the horizon? Bus riders on NJ Transit complain that there's not enough distance between because of service cuts. NJ Transit is saying it's only a few bus routes that are affected by this, and they don't have enough manpower to add more service. But riders that have no choice but to take the bus don't feel safe. Do you have a comment on that? And finally, in business, can you update us on how the process for collecting unemployment is going, since there's so many people who are trying to get unemployment and just can't seem to get through?
So I think that these are largely on me, but anyone who would like to come in, please feel free to jump in. You know, I think as you've seen today with state and county parks, which is a big step, the question of a full lockdown, there's not much left that we haven't bolted to the floor at this point. We are still looking at a few other, I mean, Judy's just been, in answer to Dave's question, you know, long-term care facilities is an area where we know that we need to even drill down even further. We've talked about corrections. I think our commissioner is going to be with us at the end of the week. Homes for the developmentally disabled, psychiatric hospitals. There are certain pockets of our state, of communities of our state, where we know we need to be as sharp as we can be. But you know, there are other steps that we're considering, but we've taken most of the big ones that we think we both need to take, and at the same time allow the state to reasonably and responsibly get on its feet in a reasonable time frame. On NJ Transit, and Dan Bryan is here, who spent a lot of time there. You've got to, you know, we want to know if folks are having that experience, go on our website and let us know explicitly which route that was. NJ Transit's got the challenge right now, and I'm not absolving a bus that's overcrowded, but diminished service. Their ridership is down, I think, 93%. They've also got manpower challenges, which are real. And when we hear these stories, we want to make sure we run them down. And there's still a lot of particularly essential folks who are using buses in particular to get to, you know, healthcare worker, by example, get to a hospital. So I'm not going to say we're batting 1,000, but we do want to know those experiences. And I can't throw a rock at NJ Transit because I know that ridership is way down. Service has to somehow approximate that, and they've got real manpower issues. Business, unemployment, pardon me. I don't have an update for you today. I promise you Mahen or Dan will get you one in terms of what their numbers look like in terms of early week. Rob Acero Angelo talked about, I forget what day he was with us, but they had processed 33,000 claims. We'll come back to you and give you a sense of how many claims they're processing per day right now, and give a sense maybe what the backlog looks like. I don't have a specific answer.
Thank you.
But again, we're on it. And by the way, if you are having trouble getting through, again, there's a page on covid19.nj.gov. If you've lost your job and you want advice, you want to know where you need to go to get unemployment insurance, et cetera. Troy.
Yes, thank you, Governor. Just one question and maybe a follow-up today. It's for Dr. Repollet. It's about long-range facilities plans for districts. The New Brunswick Board of Education submitted an amendment to their long-range facilities plan that is controversial to say the least. I, for one, have not been able to obtain the language of this amendment because the Board of Education has stopped responding to Open Public Records Act requests, and I know other community members are still waiting on records requests that would show the extent of contamination at sites where school construction is proposed. So in light of that, Mr. Commissioner, will you wait to make a final decision on this very significant proposal until the state of emergency is over and the public can obtain the information that they need to give your team intelligent and informed input and make their voices heard?
Do you have anything else, or is that it?
That's all, just maybe a follow-up depending on the answer.
Depending on what your answer is. Okay. Lamont?
Well, there's a process, but right now we're in the midst of ensuring we have continuous instruction. However, I have Colleen Schultz, our Deputy Assistant Commissioner, right there, get the information in regards, and we can try to track down and find out exactly the long-range facility plan that you're actually talking about, because that sits in our Office of Finance, so we'll make sure we get back to you with that.
Okay, thank you. And just in case you do move forward with that process, how would you advise parents and taxpayers and other stakeholders to, either protest the plan or provide comments or input? I'm sure they could have a gathering outside your office, but the governor and the state police probably wouldn't look too kindly upon that.
So I would say, back to what you asked me about protests the other day, don't protest as a group. We respect folks who want to protest, find some other way to do it, virtually, online, whatever it might be. And secondly, we're going to get back to you with a more specific answer on this in particular. If that's okay. Thank you. Do you have a question, sir? No, you're good? Back here. Elise, how are you? Come on down. Matt?
I'm good, thanks for asking.
So we'll make sure, can someone get back, make sure with Lamont's office we get back to Troy. Thank you.
What's the status of any ventilator ethics guidelines that the state was considering? Nursing home operator Care One reportedly had 5 coronavirus deaths at its New Milford location in Bergen County. Care One issued a statement saying it wasn't prudent for it to update the public daily on coronavirus in its nursing homes. What information exactly have you told nursing homes to make available, and to whom? What is the deadline? How much information does the state have from nursing homes on hand? Are there penalties for noncompliance? And has Care One responded to the state's request for information about New Milford and its other locations? And finally, a FEMA question. You've had a lot of praise for FEMA's work in New Jersey. Other states aren't so happy. Does New Jersey have a special relationship with FEMA because of Sandy? In other words, did that disaster help ease operations for this one? Also, some states and even a hospital system here in New Jersey have said that the federal government has seized some equipment shipments. Do you know whether any of that has been redistributed for use in New Jersey? That's it.
May I just, I think, Judy, you should hit the ventilator guidelines and nursing home questions, Care One, and more generally. I just want to repeat something Judy said earlier. We remain, I'll do the litany as I do every day, we remain way short of ventilators, personal protective equipment, beds, and healthcare workers. So we need help on all of those fronts. We're doing everything we can to stay out ahead of it. So with that health warning having been spoken, over to you, if I may.
I didn't catch all of the questions on Care One, but I can tell you that we're in actual regular daily communication with the principals from Care One because of their exposure in the state. What I mean by exposure is the number of facilities that they have. And we're working with them to determine whether their facilities can support the statewide plan, along with a number of other systems that have a number of facilities within the state. Specifically, Elise, I'm not sure what else you wanted about Care One. I just didn't hear it.
Well, I'm asking what you've requested from nursing homes throughout the state, what the deadline is, and to whom this information will be made available, and has Care One responded to the state's request for that information, and are there any penalties for noncompliance if a nursing home operator chooses not to disclose coronavirus information?
Well, the first thing is we put out a guidance yesterday to all the long-term care facilities that they must report through the portal that the New Jersey Hospital Association has set up. I have to tell you, I think that they're all reporting. I don't get any indication that they are not reporting, particularly their COVID-19 individuals, residents. I just don't have indication that they're not reporting. And by the number of reports that we have, which are over 1,000 at this point, I believe they're reporting.
I think the penalty would have been we named and shamed, right?
Yeah, and we still may have to publish along with the statewide plan what this looks like. I just don't want to put out information and say, there it is.
Right.
We have to put out information and say, here's the plan.
But are individuals who have family members, will they be privy to the information that's being put out? In other words, what is the purpose of collecting this information? Is it solely for the state's benefit, or will this information be disclosed publicly, and when?
We've asked every long-term care facility to advise, according to their statutory obligation, to advise the residents, the employees, and all of the relatives of the residents of any outbreak of any type of infection. That's been on the books for a while. We reminded them of their responsibilities, and as I shared today, we're calling every single one of them and asking to show evidence of documentation that they have either sent a letter, an email, or made a phone call to the individuals noted in the statute. It is important for individuals to know what's going on in these residences, and we feel strongly that the obligation rests with the owners. However, we do believe at the Department of Health, we have an obligation to protect all of the residents of New Jersey, including the most vulnerable, which are in the nursing homes, and that's why we are moving to a statewide plan.
Again, the onus is, and we're going to go to the FEMA questions because we got to keep rolling here, but the onus, if it's your loved one who's in nursing home X, it's nursing home X's responsibility to communicate with you and next of kin. It's less, I would think, less valuable to hear about aggregate data or data that relates to some other loved one's nursing home. FEMA, I think there are several elements to this, but when I give you a quick answer, I'd love Colonel Callahan to come in behind me on this. I think the elements that I would suggest are common ground that any state, and our state, for obvious reasons in particular, has been able to find with the administration and the federal government as a general matter. I think it also depends on the relationship you have with the particular FEMA region, in our case, Region 2, and Tom Von Essen is the guy who runs it. Number 3, as Pat Callahan may have mentioned, I think he did, the Army Corps matters here, and the relationship with FEMA does matter, and Sandy experience actually is relevant at many levels, including some of the specific players who are still on the scene, who are now working with us. So I think it takes, and I hear this all the time, I have nothing to do with this because it's Pat and Judy and their teams. I heard this from the general who's up from Georgia this morning. He said, you all have a really, the ROC is a unique asset. You've got really good people. You've got a war room mentality, keeping the barriers low between parts of government is a huge part of the mantra that we've tried to execute on from day one in peacetime as well as in a challenge like this. So the fluidity of the relationship between Judy and her team, just to pick, and Pat and his team, or when Lamont's making a decision about shutting schools, the fact of the matter is people get around one table. That all matters, I think, in our ingredients into having a good relationship. Pat?
I would agree, Governor. I think across all the pillars of emergency management, we are shoulder to shoulder with FEMA, from preparedness, response, recovery, mitigation. It is a daily relationship, and certainly Sandy assisted in that, but we've probably had, if I'm not mistaken, more than a dozen since Sandy. Well, it was El Derecho, straight line winds, flooding, Irene, snowstorms, all of those come with it the responsibility of doing preliminary damage assessments and then working through that public assistance and mitigation process to recover all of those federal dollars. And again, whether it's Tom Van Essen, Pete Gaynor himself, and on this particular disaster, the federal coordinating officer, who's FEMA's leading rep embedded at the Rock, is the retired major of emergency management from the state police. So you just couldn't ask for a better combination to all strive to get to that, that goal of guiding us all through this crisis. So it's a special team to be a part of, Elise.
I forgot, Elisa, my answer. That's nice to have a guy who was a major in the New Jersey State Police on the other team. And Jared Maples has lived this. Dan Kelly in my office. These folks are known to each other, and that helps.
Yeah, real quick.
One more time.
The ventilator ethics guidelines.
Oh, sorry.
What is the status of that?
I missed that. Ventilator ethics guidelines status.
We have a professional advisory committee that's looking at not just ventilators, but in a crisis mode, all of the types of decisions you make, admission, discharge criteria to a field hospital, those types of medications that we need to have on hand to advise our team to make sure we have what we need. And ventilator allocation and all medical treatment allocations are being discussed. So we will be coming out with some guidance for the individual hospitals. We do know at this point that mostly every hospital has their own guidance, what we call a value-based or ethical decision-making process. And we will be putting guidance on top of that to make sure that as a state, we are considering all of the special populations that we have and the types of decisions that have to be made.
Sorry about that. I forgot that question. But secondly, just as a general matter, when folks hear these questions and then they hear our answers, the point is not to shock people or make them feel uncomfortable. It is to give folks the confidence that while we are hoping for the best, we're considering all alternatives, all paths, all considerations. We have to. We would be abrogating our responsibility if we did otherwise. As again, this is a war with two fronts. One front continues to be all 9 million of us pounding the heck out of that curve, staying at home, keeping away from each other, and lessening the burden. The other front is making all the decisions, capacity and otherwise, over here in the healthcare system. Please God, the 9 million of us, the so many, do the work over here so that the so few over here don't have to deal with these eventualities. And we have the capacity that we need to be able to digest this crisis. So thank you. Again, sorry I missed it. Nikita.
So I have a few for you today. I'm wondering, have you spoken with either Bernie Sanders or Joe Biden about the issues that New Jersey faces as a result of this crisis? Have you gone to any of your predecessors in the governor's office for advice on how to handle the same? And on compliance for either you or Colonel Callahan, have there been any issues of election-related noncompliance incidents, whether it be political events or canvassing or anything of the like? And then lastly, have there been any changes, or are there any changes under consideration for safe haven laws in the state?
For what, sorry?
For safe haven laws.
Okay. I have not spoken with either Joe Biden or Bernie Sanders. Nothing personal, by the way. I just haven't spoken with them. Want to make sure this isn't one of them calling me right now. Predecessors, I'm sure I have. I'll have to come back to you on that. I'm just. I know I've gotten inputs from a lot of folks. I get that constantly. I'm sure that was one of them. I mostly have looked, frankly, at models of what's worked and what's not worked in other challenging times in the past. So, Pat, are you aware of any election-related noncompliance?
I think I would be, and I've not heard of any.
Nor am I. I'm not at all. And safe haven laws, Paramount, anything you want to add to that?
No, I don't think we've had any discussions on that.
I don't think we've had any not that I've been a part of, and I assume you know. Thank you. John?
To quickly follow up on some of the things Elise was asking about nursing homes, is there a deadline for the nursing homes to disclose this information to you, and if there's any penalties to be assessed on that? And then I have questions regarding the decisions, Governor, you were talking to other governors about reopening things. What specific benchmarks are you looking at to make the decision about reopening things? And the way things were shut down in New Jersey, it was a rolling into the full lockdown. Do you envision, or have you discussed whether restrictions will be lifted all at once or eased into? And again, have you, in making these decisions and talking about them, have you thought about how you're going to do this again if needed, if there's a bounce back in the virus? And again, following up on the New Jersey Transit questions, is there any consideration at all to halting New Jersey Transit services if, especially in the crowded bus lines, that social distancing can't be maintained, and given the staffing shortages, there's almost, I think, 800 or so employees on quarantine and several ill. And again, on the developmental disability in the psychiatric hospitals, is there widespread testing of employees right now, or just symptomatic employees? And can you give any specifics about the Hatteras Printing Company, how that donation came to be, who did it? And a while back, you signed an executive order about providing hospitals required.
John, you're starting to sound a lot like Brent.
There's a lot of questions.
Yeah.
You signed an executive order for this hospitals to provide information to you guys, and you said that would at some point be made public. Can you provide the daily updates in terms of hospitalization, ICUs, all of that in the charts that you presented at the beginning? Because people are really wondering how many people are sick, are they getting better, what's it looking like? And that's one of the biggest questions we're getting for that kind of information.
Let me hit a couple, and then Judy. I almost don't even like talking about lifting restrictions because we're not even close. So let me just say that as everybody watching, stay at home.
Qui ça nous doit connaître sous coronavirus là? Lavez-nous à de l'eau avec savon pendant 20 secondes. Ou bien chanter Happy Birthday 2 fois. Lavez-nous souvent et très souvent. Les n'a toussé dans le coude nous. Éteignez dans un mouchoir et puis jetez-le. Désinfectez nous avec sanitizer. Pas bailler la main, ni pas embrasser pièce moun. Pas mettre main nous dans bouche nous, dans yeux nous, ak dans main nous. Restez connecté avec PCVI Network pour plus d'informations sur le coronavirus là ou COVID-19.
Téléphone c'est 516 238 50.